Welcome to a deep dive that's going to challenge a fundamental assumption many of us hold about health. We're constantly told that medical science is on this relentless march, delivering miracle cures, and that the
Mhm.
more we spend on advanced treatments, the healthier we become. But, well, is that truly the case?
It's certainly a powerful narrative, isn't it? It inspires hope and justifies immense spending. But when you connect this to the bigger picture of American health, a very different, maybe uncomfortable story starts to emerge.
Absolutely. Today, we're diving deep into Robert M. Kaplan's really thought-provoking book, More Than Medicine, The Broken Promise of American Health.
Uh-huh.
Our mission is to understand why the U.S. health system, despite being the most expensive in the world, often lags behind other developed nations in key health outcomes, and also to explore what factors genuinely contribute to a longer, healthier life. So as we start to unpack this core premise, what immediately strikes you?
Well, what's immediately clear from the book is its unflinching questioning of the return on investment, for our massive healthcare spending. It really forces us to ask, are we truly getting our money's worth?
Okay, let's unpack this miracle cure narrative that's, well, so prevalent. The book opens by acknowledging incredible medical advancements. It even quotes NIH Director Francis Collins on significant drops in heart disease and stroke death rates, often attributed to biomedical research and new drugs. But there's a crucial nuance here, isn't there?
Yeah, exactly. While new medications have undoubtedly played a role, the source highlights a critical point. A review of over 50 studies indicates at least 50% of that impressive mortality reduction is actually attributable to non-medical factors. So the miracle cures we celebrate, often only half the story.
The non-medical factors. Okay, that really broadens the scope. Can you give us an example?
The most significant one cited is the decline in tobacco use. It's fascinating, really. You see how the course of the heart disease epidemic in the US so closely mirrors the popularity of cigarette smoking. It was rising around 1910, plateauing in 1945, and then dramatically falling after 1970. That's well before many of our modern heart medicines became, widely available.
Huh. So that suggests a population-level behavioral shift had this huge impact even before the advanced drugs kicked in.
Precisely.
So, okay, despite spending the most on healthcare, where does the U.S. actually stand on key health indicators compared to other wealthy nations? Does all that spending translate to better outcomes?
Unfortunately, no, not really. The U.S. consistently ranks last among rich nations on key indicators like life expectancy and the probability of surviving to age 50. Americans just have shorter life expectancies and significantly higher infant mortality rate.
Last. Wow.
Yeah. And the book presents this compelling figure, right? It shows no clear positive correlation between the percentage of GDP spent on healthcare and female life expectancy across OECD countries. So, like in 2006, US women were ninth out of 10 wealthy countries in current life expectancy for 50-year-olds. Meanwhile, countries like Japan, France, Spain, they spent far less but saw more rapid increases.
So less spending, better results in some cases?
It looks that way. And even in infant mortality, where the U.S. did see a 20% drop between 1999 and 2010, which is good, it's still last among 17 comparable countries, even when you control for socioeconomic factors. We also have the second highest rate of low birth weight babies in that same comparison group.
That's a really stark picture. So if pouring money into the system isn't yielding better health outcomes overall, what does the book say about our investment in, like, cutting-edge medical research? It mentions something called moonshot medicine.
Right, and this brings up a critical question. Is the immense promise of genomics and precision medicine truly delivering? Take the Human Genome Project. A monumental undertaking, right? But almost 2 decades later, we're still largely waiting for widely applicable, useful genetic therapies.
Still waiting.
Yeah, it reveals this kind of sobering truth. Despite the huge investment and grand promises, the moonshot approach in biology hasn't yet yielded those revolutionary genetic therapies we hoped for. It really challenges where our research dollars are best spent.
And what about that whole burgeoning industry of consumer genetic tests? Are they living up to the hype?
The source is quite critical here. It mentions companies like 23andMe and Oversure. They offer tests for conditions like Alzheimer's, obesity, ovarian cancer. But the FDA later found these tests were not analytically or clinically validated, meaning they weren't proven to be accurate or useful. They sometimes produced false positives, which, you can imagine, could lead to unnecessary and potentially harmful surgeries. Yeah, so it suggests that for all the investment and sort of allure these tests have attracted, there are no obvious benefits and actually significant potential for harm.
Okay, so it's not just the grand moonshot promises falling short.
Mm.
The book digs deeper, right, into the foundations of biomedical research itself. It talks about a reproducibility problem.
Mm.
What does that mean for science?
It's a huge issue, a really big one. The source details how billions and estimated $28 billion annually are effectively wasted on studies that can't be replicated.
28 billion.
Annually, yeah. Imagine a tumor treatment claiming, say, 900% improvement in mice. But when someone else tries to replicate it, they only see a 30% improvement.
That's a massive drop-off.
Huge. Or a pharmaceutical company that couldn't reproduce 65% of its own studies on potential drug targets. This voltage drop, as they call it, means early trials often show these inflated results compared to actual real-world effectiveness. And that impacts everything drug development, our basic understanding of disease.
And then there's this idea of big science, these massive coordinated efforts like the Human Brain Project. How does that fit in?
Well, while big science has led to incredible breakthroughs in fields like physics, particle accelerators and whatnot, in biology, the failures have been, well, equally great sometimes. The Human Brain Project, a $1.3 billion EU-funded effort to simulate the human brain, was deemed in disarray by independent reviewers.
In disarray.
Yeah, with concerns it was putting all our eggs in one basket, basically betting too much on one approach. And this isn't just about individual projects. A 2017 study by economists at Stanford and MIT found something really interesting. Despite far more scientists today than in the past, their useful output has actually decreased per capita.
Fewer breakthroughs per scientist.
Seems like it. A significant increase in publications and clinical trials hasn't translated into proportionally greater life expectancy or more drug approvals. It's puzzling.
Okay, so if our current medical system isn't always delivering through advanced research or big projects, what else is impacting American health? The book starts with something pretty stark: medical errors.
Yeah, and what's truly sobering here is the scale. Medical errors were estimated as the third leading cause of death in the United States.
The third.
Third, causing between 44,000 and 98,000 hospital deaths annually, according to a 2000 Institute of Medicine report. And this isn't just, individual mistakes. It includes systemic issues, wrong diagnoses, surgical failures, medication errors.
That's shocking. I mean,
Yeah.
deeply concerning. Are there solutions being implemented? Are we getting better at this?
Absolutely. There's some good news here. Quality improvement initiatives have shown significant success. Take Dr. Peter Pronavost's simple checklist for preventing catheter-induced infections. Just a basic checklist. It dramatically reduced infection rates from 2.7 per 1,000 down to 0 within just 3 months in the hospitals that used it.
0 from a checklist.
0. Yeah. Similarly, initiatives like shortening the door-to-balloon time for heart attack patients, that crucial window.
Right, getting that artery opened fast.
Exactly. And rapid administration of TPA, the clot-busting drug for strokes. These have become critical metrics. Streamlining these responses is literally saving lives. And there's Improve Care Now, a national network for kids with Crohn's and ulcerative colitis. Another example of how using collective data leads to much better outcomes.
So these examples show how simple, focused improvements within the system can make a huge difference. Which really leads us to the heart of the book's argument, doesn't it? The social and behavioral determinants of health. This isn't just about treating illness. It feels like it's about so much more than what happens in a doctor's office.
It really challenges our whole paradigm. Why do we focus so heavily, almost obsessively, on individual medical interventions, when factors like poverty, access to education, housing, social conditions are such powerful predictors of health, often even more powerful than medical care itself?
So it begs the question of where our resources are actually most impactful.
Exactly.
Can you give us a vivid illustration of this? Something concrete.
The comparison between two Philadelphia zip codes is really striking. They're just 4.1 miles apart. Babies born in one zip code can expect to live to 88, but babies born in the neighboring zip code, they live more than 20 years less on average.
20 years, just 4 miles away.
20 years. And this isn't just about healthcare access alone. It's profoundly linked to factors like, quality education, housing quality, safe places to exercise, pollution levels, even public transit options. All these things add up.
And what about the role of income? How does that play into this health equation?
Income inequality shows a clear, undeniable association. Women in the top 1% of income live 10.1 years longer than those in the bottom 1%. For men, the gap is even bigger, 14.6 years.
Wow. Over a decade difference based on income level.
Yeah. And again, it's not just about who can afford the best insurance or the fanciest doctor. It's about the broader socioeconomic conditions that shape daily life, stress levels, opportunities.
And race, too, is mentioned as a significant factor in these disparities.
Tragically, yes. Non-Hispanic black men live 7.3 fewer years than white men, on average. Black women live 5.9 fewer years than white women. And the book highlights the Flint water crisis as this just tragic and potent example of how systemic issues like lead contamination and then the subsequent Legionnaire's disease outbreak, how these things disproportionately hammer vulnerable communities and expose these stark health inequities.
It really brings it home. Now, beyond income and environment, the book highlights something else that many might overlook, but which it says carries immense weight: the role of social connections.
That's a fascinating and, I think, often underappreciated aspect. There's this study, the Alameda County study. It followed nearly 7,000 adults for decades, and it found a remarkably strong relationship between social support and longevity. People with more social contacts, family, friends, community activities, church groups, whatever, live significantly longer.
Longer just by having more friends or connections.
Significantly longer. And a British study found unmarried or non-cohabitating men had a 77% greater age-adjusted mortality risk. 77%. So this isn't just like a nice-to-have social thing. It's a profound public health issue. Loneliness kills.
Okay, what about individual behavioral factors? We all know smoking is bad, obviously, but what's the sheer scale of impact for smoking or other behaviors?
That's a critical point, and the data is stark. Really stark. In fact, the top 10 causes of death in the U.S. are all tied in some way to behavioral risk
With
factors.
10?
All 10. Think about diet, exercise, smoking, alcohol, substance use. Take the opioid epidemic, for instance. The book calls it a peculiarly American problem. In 2015, we had 312 drug-related deaths per million Americans aged 15-64. Compare that to just 6 in Portugal or 7 in France. It's astronomical.
This difference is unbelievable.
It underscores just how powerful our collective choices and maybe the societal structures around behavior really are.
But haven't we actually made some significant progress on some major behavioral changes, like you mentioned smoking earlier?
Yeah, absolutely. And that's the hopeful side, right? Smoking rates fell dramatically from 42.7% in 1964 down to 16.8% in 2014. And this wasn't an accident. It was thanks to coordinated public health campaigns, taxes on tobacco, smoking bans in public places.
So policy works.
Policy can work powerfully. A meta-analysis even showed a 17% reduction in acute heart attacks in communities that implemented smoking bans. Mexico's sugar tax is another example. It reduced consumption by 7.6%, especially among lower-income groups who are often most affected by related health issues.
Okay, so if we're seeing these huge impacts from social factors, environmental factors, behavioral factors, what does this all mean for the future of American health? How does the book envision a path forward?
Well, we connect all these dots. It means moving beyond what the book calls System 1.0, that old 19th century find the disease and fix it model, and even beyond the 20th century disease management approach of System 2.0. The book argues we desperately need System 3.0.
System 3.0.
Yeah. A transformative approach centered on prevent, promote, and care, where we look to schools, social services, environmental agencies, not just hospitals and clinics, as key partners in creating health.
That sounds like a massive shift, almost revolutionary, in how we think about health and where it comes from. Are there any practical examples of this System 3.0 already happening, things we can point to?
Yes, thankfully there are promising signs. Little pockets of innovation. In Hawaii, for instance, a state senator proposed allowing doctors to literally prescribe housing for homeless patients, the estimate. A 43% reduction in Medicaid bills once those patients were housed. Housing as healthcare.
Prescribing housing. Interesting.
Right. Or consider the capable program Community Aging in Place, advancing better living for elders. It provides home visits nurses, occupational therapists, handymen for low-income seniors with functional limitations. The result, an estimated saving of $867 per month per participant in medical costs because people could stay safely at home longer.
That's fascinating. So investing in social services, things like housing or home help, can actually save healthcare costs. It seems counterintuitive given how budgets usually work.
Precisely. But the data suggests it's true. The book cites examples of area agencies on aging AAAs having formal ties with healthcare providers. And those ties led to significantly lower hospital readmissions and fewer people needing nursing home placements. The core challenge, of course, is that the money often comes from different budgets, right?
Hmm?
Social services versus healthcare makes coordination incredibly difficult, even when it makes perfect
The
sense.
silo problem.
Exactly, the silo problem.
And what about waste within our current healthcare system itself? Does the book address that?
Oh, yeah. It details significant waste. Donald Berwick and Andrew Hackbarth identified these 6 systemic pathologies, things that cause waste. They estimated it costs between $765 billion and $935 billion in annual waste.
Almost $1 trillion
Yeah.
wasted.
Annually, yeah. Things like failures in delivering care, poor care coordination between different doctors or hospitals, and overtreatment. Think about unnecessary surgeries, tests that aren't needed or really inconsistent, sometimes overly aggressive, end-of-life care. These all contribute massively to the financial burden, often without actually improving health outcomes, sometimes making them worse.
So this entire deep dive has really been about asking if we're truly getting what we pay for in American health. When you distill everything down, from the miracle cure myth to social determinants to system waste, what's the most profound takeaway for you?
I think it begs this really important question for all of us, right? We are exceptionally good, maybe the best in the world, at treating really sick patients, assuming, and it's a big assumption, assuming they can afford the care and that the system's own pathologies don't undermine that care. But we've done far, far too little to improve the fundamental social and environmental conditions that just mass-produce ill health in the first place. We're treating the symptoms, not the cause.
So what does this all mean for you, listening right now? This deep dive into more than medicine truly forces us to confront this reality. That our health isn't solely defined by, fancy medical interventions or the latest drugs, not by a long shot. It's deeply intertwined with our social environments, our daily behaviors, the quality of our air and water, and the very systems we've built or failed to build to support well-being.
Yeah, and knowledge is most valuable when it's understood and applied, isn't it? This shift in thinking from just find and fix to this broader model of prevent, promote, and care, it could lead to not only healthier lives for everyone,
Yeah.
but also a more efficient, less wasteful, and less costly system overall. It's really about spending differently, maybe smarter, not just spending more.
A powerful thought to leave you with. And something to consider maybe for your own life and your own community. What small social or behavioral shift could you maybe champion or just participate in right where you live? That might have a ripple effect on health, maybe far beyond what any expensive new drug could ever achieve.